Good day, I'm Stephen McHugh, and this is your JIS News for Wednesday, February 7. The highly anticipated new Road Traffic Act has been passed in the House of Representatives. The bill, which was tabled on September 9, 2016, received approval yesterday when it was passed with 131 amendments. The legislation will replace the Road Traffic Act of 1938, sections of which have become outdated due to the technological developments in motor vehicle and road designs.
Provisions in the Principal Act which set out the principles of law, while the substantial operational details will be placed in the regulations. The placement of details in the regulations will facilitate ease of amendments when these are required.
The new law will introduce heavier fines and penalties for breaching the road code. These relate to offenses such as driving without a license, permit, or required motor vehicle insurance coverage. Stronger fines are also introduced for exceeding speed limits, loud noises, and failure to wear protective helmet, as well as failure to comply with traffic signs or to stop at pedestrian crossings. The act will come up for review within 3 years of its promulgation. The legislation will now go to the Senate, and provided there are no further amendments there, it will be submitted for the Governor General's signature before it is gazetted and passed into law. Parliament is to debate the 33 recommendations made by the Commission set up by Prime Minister Andrew Holness nearly 2 years ago to review Jamaica's relations within CARICOM and CARIFORUM. The Prime Minister tabled a copy of the report in the House of Representatives yesterday and promised a robust debate on its contents, which he says will also be shared with his colleague heads of government and the CARICOM Secretariat.
I am confident that in completing our collective review of the report, we will be able to make the right decisions and take the necessary actions to ensure the advancement of the region through CARICOM and continued cooperation with CARIFORUM states within the framework of the ACP group of states.
The Commission was established on June 20, 2016, under the chairmanship of former Prime Minister Bruce Golding. Its report was presented to Prime Minister Holness on March 30 last year and has since been discussed by the International Relations and Trade Committee of Cabinet. Mr. Holness says the document is particularly timely as Jamaica assumes the chair of CARICOM in July 2018.
We intend to pursue further review, revitalization, renewal, and restoration of CARICOM to increase its relevance and effectiveness.
Linstead Hospital's Accident and Emergency Department has been reopened following expansion and upgrading works. Over $166 million was spent, including $144.9 million to expand the A&E department and $22 million to renovate the hospital's administrative building. The project, which started in 2015, includes the purchase and installation of a state-of-the-art X-ray unit by the Southeast Regional Health Authority.
The A&E department, I am told, is equipped with additional waiting area, nebulization stations, 6 beds in the emergency room, 10-bed observation area, 3 examination rooms, triage room, minor operations room, staff lounge, pediatric observation room, and I could go on, including a parking area.
New equipment, including a minor operating table, suction machine, crash carts, defibrillators, and stretcher beds were also purchased.
In other words, the critical infrastructure to support the persons who will require the use of the facility. The aesthetics, too, has been improved and enhanced in terms of driveway, drainage, facilities, and so on.
Meanwhile, the health minister says he will soon be in a position to announce a more comprehensive national health insurance scheme for Jamaica. He says the scheme is now under active construction by the consulting firm engaged by the ministry.
And that is going to look at how we pay for a more enhanced approach to public health. And part of the new thrust, part of the way forward, is going to be to take the NHF in its current form, look at how we can add value to its role, to its function, reconcile that with how we're going to pay for it.
The National Health Fund, NHF, was established by the government to reduce the financial burden of healthcare on the population by subsidizing the cost of medication for 16 chronic illnesses. The entity pays out approximately $5 billion annually for prescription drugs. The Heart Foundation of Jamaica is increasing awareness this month on healthy nutrition and how to read labels correctly. The focus is part of Heart Month activities. Executive Director Deborah Chen says children are being targeted and the foundation welcomes the government's soon-to-be-implemented school nutrition policy. This, she says, will guide the type of foods and drinks sold in schools, which she says is an important consideration as over 30% of children are obese or overweight.
So I think that will take us a far way in the direction that we need to go, because we don't wish to see our young children, younger and younger ages, having diabetes. They may not get it as a young child, maybe in early adolescence. We don't want to see diseases that are normal in middle and old age starting to get, to a younger and younger age. Ms. Chen was speaking at a recent JIS think tank session. And finally, the Education Ministry has signed a Memorandum of Understanding with Recycling Partners of Jamaica Limited, RPJL, for 50 environmental wardens to be placed in primary schools in Clarendon and Manchester. The wardens, who have already been trained, will have responsibility for managing the collection of plastic bottles in the institutions to which they are assigned.
The 50 community source wardens will then have the opportunity to work to learn, work to earn, work to give service to the nation, and work to save for the future.
The Education Minister says this initiative is an important one, as the program will support the country's Vision 2030 goal of cultivating a healthy environment. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.